When I went to school, I wanted to be able to help people to be healthy and promote wellness and do things that really empowered patients to be able to make informed healthcare decisions.
Welcome to the Ultra Healthy Now podcast, where your journey to feeling younger, sexier, and more energized begins. Dr. Nicole Srednicki, who specializes in high-performance health, will dive into practical, actionable tips and strategies that can transform your physical, mental, and emotional well-being. Join us as we uncover the secrets to living a healthier, happier life, mind, body, and spirit. Because true health, beauty, and happiness start on the inside.
Hello, everyone, and welcome to Ultra Healthy Human. I'm your host, Alexandra Gonzalez-Ganoza, with Dr. Nicole Srednicki. And today we're going to be diving into critical topics that affect us all: healthcare versus sick care. Do you feel like you're your best high-performing self? Is the healthcare system failing you? And I'm sure we've all felt like this at one point. And in today's episode, we'll be taking a closer look at the current state of our healthcare system and if pharmaceutical companies and insurance companies are actually, truly looking out for our well-being, or are profits steering this ship? From rising chronic disease rates to medical errors contributing to fatalities, it's clear that there's major issues and flaws in our system. And so I'm so happy that we have Dr. Nicole on as our expert, Dr. Srednicki, with all her expertise and background, testimonials to truly provide clarity in today's day and age with so much information out there. So thank you, Dr. Nicole. I'm so excited to be doing this podcast with you.
Thanks, Alexandra. So in the U.S., predominantly Western medicine is used, and it's failing society. This is evidenced by chronic disease rates, healthcare expenditures, and death rates. With chronic disease, we do have people living longer in the U.S., which is great. However, there's a lack of quality of life. There are medications to sustain life, but it doesn't necessarily improve their life. And the goal should be both longevity and quality of life. Mm-hmm. So why is this failing us? Ultimately, the healthcare system is interconnected between the insurance system and pharma. It's not targeted at preventative medicine. It only addresses part of the problem. Nothing to do with preventing, only stabilizing and treating. How many times have you been to the doctor and they aren't addressing the underlying cause of what's going on? They hear you rattle off a few symptoms and, let's say you have a sinus thing going on, and they're just quick to, here's a prescription, okay, bye, right? Mm-hmm. And you're not really getting answers. Why are you getting these infections? And so it's like sometimes a Band-Aid. So why does this matter? It's costing a lot of money. Everybody has high insurance premiums. It's costing the system a lot of money. And it's not effective in terms of true quality health outcomes. And it loops people into other problems as a result of the pharmaceuticals. It's causing premature aging, along with, when people are on multiple medications, what comes along with that, all the side effects. Yeah. So let's talk some statistics. Healthcare expenditures. The U.S. spends more on healthcare per capita than any other country in the world. The healthcare expenditures are reaching over $3.8 trillion annually. And healthcare spending accounts for approximately 17% of the GDP. Yeah, those are some huge statistics you just shared with us. And, you mentioned before how, we're loaded with prescriptions, which is actually my story before coming to see you, right? I was sick every month. I was on antibiotics every month, and truly not feeling my best. Even though this medication was supposed to be helping me, I was feeling worse. And so, I think this is a very important show for everybody, a very important podcast for everybody to tune into. And, we know that medical errors are unfortunately a major concern in healthcare, right? Can you talk about some of these common errors our users or viewers should be listening to and keeping an eye out for, and how they impact patient safety and outcomes? Absolutely. And thanks for sharing your personal stories, Alex. That's much appreciated because, health information is very personal and private, but I think when we can share information, stories, it's help for other people. So thank you for that.
No, of course.
So medical errors. So these can account for all different, sometimes referred to as adverse drug events, which could be side effects that you have from a medication, adverse reactions. If you get a rash or you get a headache or you get bloated, or even more severe, there could be allergic reactions. Drug interactions when you're on multiple medications. Sometimes they can interact with each other. And then, of course, medication errors. There can also be, more in an inpatient setting, or if you're at a outpatient facility getting a procedure, there can be equipment failure, or failure to provide prophylactic treatment. This is super important. For example, like if you're having a surgery that they have you maybe stop certain supplements or medications. And then also, maybe they have to put you on a blood thinner or something like that. So, always having that education so that you can always, advocate for yourself as well. And some of the big ones too are delayed diagnosis. And with delayed diagnosis, I see this happening all the time in traditional medicine because again, the games of insurance companies delaying testing because they don't want to pay for it. And that's another type of potential medical errors, failure to utilize appropriate tests. In my opinion, I think that sometimes the insurance companies are doing a disservice. And, sometimes the doctors, their hands are tied because they're so used to working in an insurance-driven system. They have to follow these standardized protocols. With insurance, I see this a lot with blood tests. They don't want to cover really anything preventative. They look for diseases that are already there. When a patient can clearly, we could take better care of them if we had more coverage for more blood tests. And imaging, this happens all the time. Like, do you know somebody that's ever hurt, their shoulder or their knee? And what happens? They go to the doctor. The doctor says, oh, let's get an x-ray. When there's something clearly wrong and they're going to get an MRI, it does cost money. But now, because of insurance, we're just wasting the patient's time and resources. The healthcare system still has to pay for that x-ray that's not going to do much for us. And then we turn around and get the MRI. So, just a couple examples of, some of the failure to utilize appropriate tests, delayed diagnosis, things like that. According to the landmark study by the Institute of Medicine, as many as 98,000 people die each year in the U.S. due to medical errors. And subsequent research shows that the actual number of deaths related to medical errors is actually much higher than that. I want to share a quick story about one of my patients. He is in his 60s. When he first came to me, gosh, he's been my patient a long time now. When he first came to me, he used to be in one of the VIP medallion programs at one of the prestigious hospitals here in Arizona. So he had that higher level of care where he paid an annual fee and they go in depth and really do all of this testing. And so when he came to me, I did all of my comprehensive blood work, and one of the blood tests came back abnormal. And so we investigated that a little bit more. I did a couple other blood tests, and it turned out he had a potentially deadly genetic disease that was missed at this other facility. And I mean, we went back through the history of what he had done at the other facility, and there were actually markers that came up that should have triggered them to do further testing, but they didn't. And if we hadn't found this, he probably wouldn't have gotten diagnosed until way down the road when he had severe symptoms, because with this disease, it's called hemochromatosis. It's an iron overload issue where your body stores all of your iron in different organs. And so you have these iron deposits that start to accumulate in your liver, in your heart, in your brain. And usually people don't have symptoms until they have severe fibrosis of their liver, or they're really noticing, it's in their heart and they're really starting to slow down and feel those symptoms. So luckily we were able to catch this really early, start treatment, and we've been able to actually reverse some of the damage, which is incredible. And this patient, he says that I have saved his life, and I guess it is true. We really have to advocate for ourselves and have health practitioners that are really looking out for us. And just being really thorough from both sides of the preventative medicine and Western medicine.
Of course. And, it's alarming to hear that medical errors is one of the leading causes of death in the U.S. I mean, that's shocking. And that should really prove to us that we need to take matters into our own hands. A lot of our listeners, obviously, Rich Dad community, right? They're entrepreneurs. And so we know what it's like to run a business. And so, of course, right, the medical industry is also a business, right? Pharmaceutical companies are a business. And so what do they say? Follow the money, right? And it might make you question, like, why certain things are not checked for, especially if you said that there were certain markers. I know I'm the host of the show, but I've been a patient for a very long time. And I know what it's like, because you're very thorough, and that's something a lot of doctors don't do. And just by a couple of blood tests, like you said, you can catch so many things that could potentially save your life, right? Or just allow you to live a higher quality of life, be a high performing individual, like all these investors and entrepreneurs need to be. And so I mentioned, we need to follow the money. How do pharmaceutical companies and insurance influence healthcare in the U.S.? And what does this mean for us? Or what does this mean for every patient out there?
So this was one of the things that I was underwhelmed with when I was in school. When I went to school, I wanted to be able to help people to be healthy and promote wellness and do things that really empowered patients to be able to make informed healthcare decisions, have continuity of care. I had all these big dreams. And then when I was in school, I had a great clinical education, but they pushed so much, how to write prescriptions and get patients in and out of the office as fast as possible and do what the insurance says. And I was like, well, there has to be more than that, just writing prescriptions, because it's, in some cases it absolutely helps. I'm not on one side or the other. There are certain cases where you absolutely need a prescription. But we have to find that balance, and we aren't really taught that in school. And so that's when I graduated, I went on to do all these other board certifications so that I could be equipped to really, show people or help you guide them to, the health goal, to meet the health goals that they desire. So I'll go to a few more statistics. The number of prescriptions filled in pharmacies in 2019 in the U.S. were over 5 billion. And this number has been steadily increasing over the years due to all different factors such as population growth, our aging demographics, and the rise in prevalence of chronic disease. Remember, we just mentioned that people are living longer, which is a good thing. But with increasing prevalence, we're missing a piece of that puzzle. You don't want to live a miserable life that's prolonged, right? We all want quality. And prescription trends in the U.S., chronic diseases such as hypertension, which is high blood pressure, hyperlipidemia, which is high cholesterol, diabetes, and of course, mental health disorders that is on the rise. So we see, statins, antihypertensive, antidepressants, diabetes meds, all of these drugs are being written like crazy. Yeah. So let's talk health insurance for a second. The excessive costs that only cover disease. I don't know if you've noticed your insurance premiums this year. They just keep going up, and it seems like they cover less and less. They don't do anything preventative. And again, health insurance is a necessity. We all need it because if something bad happens, it's going to be helpful. But as far as being healthy, you can't just depend on it. I have health insurance. My annual physical is what, they say I'm healthy, but what are they doing in your annual physical? They're looking for disease that's already there. They aren't doing anything proactive for you. So, health insurance helps you when you're sick, but doing nothing to keep you healthy. Remember that. The insurance companies essentially dictate your treatment plan. So from the doctor's side of things, as I mentioned before, our hands are tied sometimes. If you don't have a doctor that's advocating for you and fighting with the insurance companies, which oftentimes, it's not that you have a mean doctor, but they don't have the time, because if they're an insurance-based system, they get to see 30, 40 patients a day. When do they have time to get on the phone to the insurance company and advocate for what's best for you? In my practice, I don't write very many prescriptions because we're always working on foundational changes, which often alleviate the necessity for prescriptions. Don't get me wrong. As I mentioned earlier, if you walk in the office and your blood pressure is 160 over 100, you are absolutely getting a prescription that day. But the goal would be, what do we do to get you back off of that medication?
And I just want to highlight the importance of that, Nicole, especially for all our viewers when, looking for a doctor, because there's something that has truly transformed my health. And I know so many other individuals, we've gone to so many conferences for these entrepreneurs, for like your patients, Robert Kiyosaki, Ken McElroy, right? These are high-performing people that need high-performance health. And so one thing that really struck out to me is that, you do write prescriptions when they're needed, right? And so before going to you, I was on a bunch of antibiotics and still feeling awful. And I'm telling you, month after month on different antibiotics for different things, because everything was causing another side effect. And so it's just alarming how we don't try and treat things without the prescription first. And so, for you, like, you did the thorough blood work test and you were like, oh, maybe anxiety is being caused by this. Maybe anxiety is being caused like this. Let's reset your body instead of just feeding you all these pills that are doing you more harm than good, right? All the skin infections I was dealing with. And so there's really underlying causes that if the doctor would just go an extra step, or I get it, their hands are tied because of the system, but if they were just permitted to go that extra step, majority of people would not be on these pills. To come into the doctor and say, I'm feeling overwhelmed, I'm feeling anxious, I'm feeling depressed, and then be automatically fed a pill, or because you can't concentrate, which I learned, maybe my body's not methylating right? So it's like, maybe I'm not absorbing the vitamins I need to concentrate. And now thanks to you, I am able to, right? There's no anxiety, there's no depression, there's no ADHD, which are common things that we're just fed pills for. And how that can really be cured by you, like what you mentioned, a thorough analysis, restarting your body. But I'm witness of it. When I need a prescription, you'll write it up, right? So something that's very unique about you is that you're not one way or the other. You combine both, which I love, because you're not just in denial of the system. You merge both of them together, right? Which is what I think makes your practice so successful, and why everybody goes to you.
Thank you. Yeah, and I think that is super important that for any health practitioners out there, I think they should keep their eyes open to both sides of it. And I've seen this sometimes. I like to collaborate with other providers, because like science is, medicine's constantly evolving. And I think sometimes that, having a team is super important. If you're a traditional doctor, I think you should have your eyes open to a little bit of, the other side, the natural, the functional medicine side of things. Same with, if you're a naturopath, you should be open to, Western medicine as well, and kind of, using a combination when needed, or, that can be used when we're trying to rule out something, really seeing both sides. But I see often that these butt heads, and in the medical community, like, we also need to learn how to work together, keeping the patient as number one, not our egos.
Yeah, I know. I love that. And like I said, it's so important for everybody listening, to make sure you find someone that combines both, because to ignore one side or the other, I think it's awful. And, now that we're even talking about this, there are, like you mentioned, there's pros to the traditional healthcare system, right? You have a clinical background, you've done training. And so what does the medical system actually offer us?
So when you're sick, I think it can be really helpful if you have, significant cardiovascular disease and, you have a, 95% blocked artery. Guess what? Western medicine is your best friend because they are going to go in there and give you a stent. But then you go to your functional medicine doctor and figure out, we need to prevent the next artery from clogging. So now what do I do to change my lifestyle? Right. Mm-hmm. So perfect example, there's a time and a place for it. However, if you want to be healthy, you may want to seek alternative health measures. In seeing a lot of, the rich dad advisors who I'm blessed to be around, but seeing a lot of like entrepreneurs, like high stress individuals that put a lot of pressure on themselves, their body, they need to be sharp. They need to be motivated. They need to have energy. Yeah. They need to be taking a more comprehensive look and have a better health plan than just their annual physical. So it is really important, not just for entrepreneurs, but everybody out there. We all want to feel good, right? Like how many people want more energy? How many people want mental clarity? Sleep well, not have joint pain, all of that good stuff. Yeah. And something to ponder. This came to me the other day. The medical care system needs you to be sick in order to make money. So what's their incentive to keep you healthy? Like we need to take control of our own health.
Yep. I mean, that's their business. They're in sales, right? We're all entrepreneurs. We understand that world. And so they're just trying to retain a client. They're just trying to make you come in as often as possible, feed you their product as often as possible, which would be pills. And, something you mentioned as, cardiovascular, yeah, that will be your best bet, right? The traditional system will be your best bet. But at the same time, one thing I've learned about what you do is that the traditional system is very reactive instead of proactive, right? So many of those things could be avoided. And what's alarming to me, being a patient in the past of the traditional system, is that so many things are just, kind of, they tell you go in for bloating, you go in for mental fatigue, you go in because you can't concentrate, or because, you don't feel high energy, and they're like, that's normal. That's normal. They brush it off and they don't look for what's actually causing it. And so for me, it's like being a part of the rich dad community. You need to be high performing. I need to have mental clarity. I need to be sharp. I need to be able to speak at these conferences, retain information, digest my food properly, sleep well. And all this is just disregarded in the traditional system. And so I really want to highlight the importance of, what you're combining that functional medicine in an entrepreneur's life really is, right? Because they need to be these high performing individuals. And I bet you there's so many entrepreneurs listening to us that could be a better version. And if they were to invest in their health, they would see that their business, just like my testimony and so many others, will increase. Their sales will increase, their revenue will increase because they're high performing, because they're able to accomplish more. So I really want to highlight that importance. And can you explain the differences between functional medicine and traditional healthcare, and how the functional medicine approach can benefit these entrepreneurs and any patient out there, right?
Yeah. So looking at the philosophy and focus behind them, and I'm going to, just list too, there's kind of some interchangeable names here. So in traditional medicine, it can also be considered conventional or Western healthcare, focuses on diagnosing and treating the disease. It often, is emphasizing symptom management rather than addressing the underlying root cause of the illness. And then on the other side of things, we have functional medicine, longevity, holistic, anti-aging, natural medicine, et cetera. And there are little variations within these, but in functional medicine, it takes a holistic approach to healthcare, viewing the body as an interconnected system and seeking to identify and address these underlying causes of the disease. And it emphasizes personalized, patient-centered care and aims to promote optimal health and wellness by addressing all different factors such as nutrition, lifestyle, genetics, environment, and the mind-body connection. And then when we look at the diagnostic approach in traditional healthcare, it's relying on standardized diagnostic tests and protocols to identify abnormalities. And then the treatment recommendations are typically based on established clinical guidelines and evidence-based practice. What's important here is that evidence-based practice means that it's been studied. So it's not like hocus pocus. And protocols can be really good. However, that generalizes people, making you like a statistic. For example, when we look at men's testosterone levels and what the range is of the recommended testosterone range, it puts a 40-year-old man in the same category as an 80-year-old man. Do you think there should be a little bit of variation between that? Nope, they're all in the same one. So, what often lacks in traditional medicine is that individualized approach. Like, you're not a statistic. You have unique genetics, lifestyle, and so your healthcare plan should be based around that. In functional medicine, it utilizes that more comprehensive and integrative approach to diagnose, with much more detailed patient histories, comprehensive physicals, and advanced blood tests that look at functional and genomic testing and assessing, really, emphasizing lifestyle and the environmental factors, which play a huge role in some of the dysfunctions that are symptoms that people start to develop and are missed. So, the key here is time with your patients. Oftentimes when you go to your functional medicine doctor, they aren't going to spend 5 minutes with you. It's going to be a much more comprehensive visit. Then when we look at treatment modalities in traditional healthcare, we know pharmaceuticals, medication, surgical procedures, and other just conventional interventions that band-aid your health depending on the diagnosis. And, it focuses primarily on managing acute and chronic conditions with an intervention. With functional medicine, the treatment is more individualized, and it's a combination. Again, going back to what I just mentioned, how much are you exercising? How much are you managing your stress, sleep hygiene? And then the utilization of botanicals, mind-body therapies, detoxification, and integrative modalities. I like to think we use very cutting-edge medicine. And, this can help to restore the balance within your body, not just treating that symptom, and to slow the aging process. A couple examples, detoxing, you know about this, Alex. You've done my
love the detox
time. The 21-day ultra healthy detox is such a great way to just reset the body and get you back to like feeling good, or the use of biologics for healing instead of jumping to surgery. So just looking at, you're able to see a lot of the alternatives. And then in patient-centered care, this is also really important when we look at the traditional healthcare system. It's this more paternalistic approach with healthcare providers making treatment decisions based upon clinical guidelines, protocols, and the patient involvement in decision-making is very low. And there's less emphasis on addressing patient preferences and values. So basically, you lose the power. Patients often give up the power to their provider. And I see this quite often. The doctor gives a diagnosis and maybe a prognosis, and the patient often thinks that's it, versus getting a second opinion or finding out what else can be done to change the variables so that the prognosis can be different and more favorable. The patient sometimes doesn't realize how much power they have in their health outcomes. Please never forget that. In functional medicine, the emphasis is on a partnership between the patients and the providers, and this focuses on empowering the patients to take an active role in their own health and well-being. And then lastly, looking at preventative care. Traditional healthcare, I've said this now a few times. It's offering screenings, looking for diseases that are already there, vaccinations and lifestyle interventions that'll help reduce the risk of developing some of the chronic diseases. Versus functional medicine, preventative medicine is the cornerstone with a strong emphasis on identifying and addressing risk factors for chronic disease before they manifest. Functional medicine doctors often prioritize proactive health promotion strategies, personal lifestyle interventions, and early detection of imbalances to help prevent. For example, something that's really important to me is when the patient first comes in to my practice, I look really in depth at their blood. I'm not just looking at, those basic things you see on your annual physical. We're looking at inflammatory markers. Inflammation is the foundation of every disease, so we should always be looking at that. Hormone panels, blood sugars, heavy metals. I call this your internal body mapping, right? We need to understand what's going on internally to identify potential areas that could become risks down the road. And when we fix these simple imbalances, it's much easier than when a symptom has already developed into either a symptom or progressed into disease. So we want to identify these subtle imbalances through energy testing, blood testing, and conversation.
Yeah.
When someone comes to me with, low energy or brain fog, low libido, weight issues, sleep issues, joint pain, when there's just these subtle imbalances, they don't just need a prescription. We need to identify that underlying cause. I bet people in the audience either have had these symptoms or know somebody that had these, and it's time to do something about it. So in summary, when we look at traditional and functional medicine, they share common goals of promoting health and treating illness, but they drastically differ in their underlying philosophies and diagnostic approaches. So both approaches have both strengths and limitations, and the choice between them, may depend on the individual preferences and health goals. But the patient needs to feel empowered. Something to think about is why not, have both of them. It's okay to get different perspectives, and address health from both sides. And we want to encompass and offer education so that patients can make informed decisions.
So we've explored crucial aspects of how to take charge of your health, of your wellness, how to feel truly amazing day to day and be a high performing individual. And so on the next show, Nicole, I really want to talk about how someone can find the right anti-aging or functional medicine doctor. And so that's just a little sneak peek and preview of what's to come. And Nicole, do you have any last words for our audience for today's show?
Yeah, just real quick, your annual physical isn't doing enough to keep you healthy. So I think it's important to understand there is a difference between health and disease. So do you want to work towards being healthy, or do you want to just work towards preventing or maintaining a disease process, right? So we need to take that extra step and look at our health in the whole big picture versus just looking at it from the annual physical perspective.
And, we mentioned detoxing your body and everything. So if you guys are interested in that, go ahead and go to ultrahealthyhuman.com, check out the resources, check out the products, see what truly strikes with you and what kind of change you want to start making in your life. And so, thank you, Dr. Nicole, for spreading so much wisdom. I am so passionate about what you do and just my own experience and the quality of my life. And so I'm excited that we're sharing this with the world. I want to thank you all for joining the Ultra Healthy Now podcast. And we hope you guys found this episode informative and eye-opening. We want to be along on your health journey. And so we'll be releasing so many episodes about, common misconceptions, things you should be looking out for to truly be healthy. Remember, your health is your greatest wealth. And so take care, stay healthy, and we'll see you guys on the next episode.
Thank you for tuning in to the Ultra Healthy Now podcast with Dr. Nicole Srednicki. To discover more, visit ultrahealthynow.com and jumpstart your wellness journey with our 21-day detox program, a total body reset, more energy, better focus, and weight reduction. Our carefully formulated high-quality supplements will aid in a new level of wellness. Don't wait. Unleash the Ultra Healthy Human within you. At Ultra Healthy Human, Eastern and Western modalities are combined with cutting-edge technology to guide personalized health programs to help you tap into the limitless potential of your mind and body. Because true health, beauty, and happiness start from within. Remember to subscribe, like, and share this episode wherever you listen to podcasts.
And before we sign off, I want to make it crystal clear that the information presented here is for informational and entertainment purposes only. This episode should not be considered a substitute for professional medical advice, diagnosis, or treatment. And while we strive to provide accurate and up-to-date information, the content discussed in this podcast is based on general knowledge and research available at the time of recording. Medical knowledge and guidelines can evolve, and what we discuss may not always reflect the most current research or recommendations. If you have specific health concerns or questions, we strongly encourage you to consult with a qualified healthcare professional or medical specialist who can provide personalized advice tailored to your unique circumstances. Every individual's health situation is unique, and what works for one person may not be suitable for another.
This podcast is a presentation of the Rich Dad Media Network.